One of the realities in healthcare is that there's a gap between thinking we do it and knowing we're doing it. And I think when you start examining where we fail in terms of quality, it's because we don't close that gap. And the 1,000 Lives campaign is giving us a different approach and a way of closing that gap. I think there's been an awful lot of enthusiasm in the Trust, and I think the clinicians have bought into piloting the implementation, and the enthusiasm at that level has now created something we need to spread. We've got to the point where we can show that we can implement the interventions in the campaign, and we can show through measurement that we've moved from thinking we do something where usually we find out we only do it 75–80% of the time, to having a robust system in place to do it 95–100% of the time. But we've now got to move that good practice, which is in small clinical areas in the Trust, out across the whole organisation. And this is part of today, in terms of being a spread event, to start that energy to say, let's now do what we know we can do across the whole organisation. I suppose part of the challenge has been in the context of being a new organisation. We're trying to make sure that there aren't barriers between hospitals and barriers between groups of clinicians. I think it's very easy, because of the size in ABM, to have a very good quality happening in one place and then not to be knowledge of it elsewhere. So one of the biggest challenges in spread is communication, because communication is going to build enthusiasm for change and perhaps get to this point where people are wanting to do something before they're being told to do something. I've certainly been working with the clinical directors to make sure the new management structures we're putting in place are aware of the campaign, are finding out what's happening from the directorate management team's perspective in the individual directorates. And then I see the directorate management teams having as much of a role as the individual clinicians in making that spread happen. When we talk about successes, I think we've always got to talk about successes in the denominator. We've had successes in defined areas. Success, to my mind, is rolling something out across the organisation. I know in 4 or 5 wards, the skin bundle that's been introduced has meant that bed sores are now a rarity after a patient is admitted to the hospital. Now that success has got to move across the whole organisation. I think the legacy has got to leave ABM delivering safer healthcare. I think that'll happen around the 42 interventions of the campaign. I think more importantly, ABM will have other clinicians in ABM might not exist then. The clinicians in ABM are going to have a different tool set. And they're going to have a tool set so that they know they can introduce things that improve patient care and make them happen consistently. That, to my mind, is the most important. I think from the noise behind me, you can hear the reception has been good. Because I think this campaign is actually empowering staff to make the changes locally around the patient that makes a difference in terms of quality of care. The need for the patient safety campaign is to close the quality gap. And that's to close the gap between thinking we're doing something and knowing we do something around patient care.